talk about ADHD. Let's just talk about definition. What is ADHD?
There's a formal definition, and the formal definition that it is a biological disorder, and it's associated with particular symptoms and a particular network in the brain. And the core symptoms are inattention, distractibility, and hyperactive impulsive behavior. That is a typically useless definition for most people. And the way it has been defined is that ADHD is like having a Ferrari engine for a brain, but with bicycle brakes. It's actually somewhat of a misnomer to call it an attention deficit, because what it actually is attention to too much. The thing is that the brain is always active. It's always putting its attention on something. And the difficulty comes in when the person can't select the object to put attention on and keep it there, because the attention wants to go where it wants to go.
Sure. So you're saying it's not trouble paying attention, it's paying attention to too many things at once.
Yes, okay. Exactly. That's well said.
Okay. So how common is it nowadays in the USA?
That is a question that keeps changing, but the current prevalence data in the United States from the Centers for Disease Control is 11%. Wow. Worldwide prevalence is 7.2%, which is huge. When you consider that evolutionary biologists say that natural selection selects for a particular condition if it's 1% of the population. This is very, very high.
Yeah, that is very high. So is it considered a learning disability?
No. Learning disabilities are associated with difficulty in manipulating or managing the symbols of language. So there are reading disabilities, there are math disabilities, we call dyslexia or dyscalculia. ADHD is a matter of placing attention to sustain attention for task completion. Associated with doing that, the way you do that is to use executive functions. Now, most of us, especially those of us who have work that requires it, and it's especially needed in school, we have to self-regulate. So in an adult example, for example, if it's 2014 and you have your taxes due and it's April 14th and taxes are due the next day and it's a beautiful day outside and you haven't done your taxes, you have to regulate yourself to sit down and get your taxes done, rather than go outside and enjoy the day. We use executive functions to do that.
Okay.
The self-regulation that is available to most neurotypical individuals, not available to an individual with ADHD. The individual with ADHD tends to live a different sort of life. They're attracted to the world around them. Using language, which is how most of us get things done. It's how I got here to talk with you. It's how you got here originally.
Sure.
It's how our administrative assistants manage people. We use language. Language to manage personal behavior in a person with ADHD is not very powerful. So we might go to the store and we might have in mind, I have to get milk, eggs, and cheese. And you get to the store, you buy what you buy, and you walk out and you have bread, and you have Havarti cheese, and you have one of the broiled chickens and you walk out with 5 things, and not one of them is one of the things that you said you were going to get. So you see, language is not as particularly potent. That's why you don't treat ADHD by counseling. Counseling is useless. I mean, I know how to say brilliant things. I can have golden words come out of my mouth when I'm talking to a child. And by the time the child ends the session and walks out the door of the hospital, at the rehab hospital, walks through the green awning, whatever I say is gone. It's why parents in managing children with ADHD, they do all this talking. And a child does something, like spills the milk. The child gives a 5-minute lecture on how you're supposed to hold the glass with 2 hands and you're supposed to, whatever it happens to be. And the next day, the child's sitting down and spills the milk again.
Yeah.
Do you get the idea?
Right.
Okay.
Right. So language is not the appropriate way to communicate with a child with ADHD.
Well, appropriate's not. I'll use a different word. It's not the effective way of making a difference for ADHD.
Okay.
I give lectures at a lot of places, and I went out to Stanford and gave a presentation there, and I told them at the very beginning, look, I'm an expert in ADHD. By the time this conversation is over, in the hour later, after we're all finished, I will know exactly who in this room is ADHD.
Wow.
Come up and talk to me afterwards.
Wow.
For example, you can often tell people who have ADHD, not because of overt symptoms, but because they seem just to notice everything. There are some adult jobs, for example, that are perfect for the ADHD brain. But when you have ADHD, your attention is on the world around you. Your attention is drawn to any change in the world around you. And if the world around you is not particularly fascinating or interesting or attention-getting, guess what? The brain generates thoughts and conditions. It can ruminate on things that happened years ago. The brain will always be attending to something. Right. That's the difficulty of ADHD. That's the nature of it. Now, when you consider adult positions, adult jobs, consider a policeman. What does a policeman have to do? Let's go. A policeman goes to a crime scene. What does he have to do or she have to do? To notice everything.
Analyze.
There are certain professions. David Neeleman, for example, was the former CEO of JetBlue. Okay. Now, those people who follow airlines and stocks, JetBlue was the most successful airlines for a long time. I think now it's second to Alaskan Air, but you know what he said? He said, I wanted to make the airlines suitable for me. I want things fast, simple, and efficient. He created it that way and created a very successful airline. In fact, you might be too young to remember when we used to use paper tickets for flying the airplane. So David Neeleman used to use paper tickets. What do you think happened to his paper ticket, given that he's ADHD?
Lost it.
He lost it, of course. So he was the one who invented the electronic ticket.
I see. Very interesting. So what is the difference between ADHD and ADD? Because I heard that a lot too. ADD, is that similar to ADHD, or is it being used anymore?
In the professional field, it's all called ADHD. Okay. There are 3 types of ADHD. There's what's called ADHD, predominantly inattentive presentation. And to diagnose ADHD, there are 9 symptoms associated with inattention and 9 symptoms associated with hyperactive impulsive behavior. An adult has to have at least 5 in either one or both of those categories. A child needs to have at least 6.
Okay.
So it's not enough, however, just to show those symptoms, because everybody shows those symptoms from time to time. Right. People who don't get enough sleep are often forgetful. People who are depressed or anxious and have actual anxiety depressive disorders often forget things or often overlook something or often seem scattered. There are certain conditions. So let's say you have a child who is inattentive, shows 8 of 9 symptoms for inattention. There have to be certain conditions there. First of all, they have to have been there for a long time. They have to happen a lot, so much so that it's intrusive. Usually, the measure that we use for intrusiveness is that the child's behavior is compromised at home and in school. In an adult, you might consider home and work. You can consider relationships. I had He's a really remarkable guy. Married and inattentive type ADHD. He told his wife, honey, I'm going to accept your request and I'm going to put up paneling in the basement just like you've asked me for the past 2 years. He went out and he bought the paneling on a Saturday, put it in the basement, and another year went by. Finally, after all of his excuses and all of the disruption that his wife had and all of her upset, when are you going to do it, all of his promises that he ultimately broke, he called up a friend of his and he said, can you come on over? I know you know how to put up paneling. Will you come over and do it? I'm going to get a keg of beer. You and I are going to go put up the paneling in the basement. I'll pay you for it. He had it done in 4 days after virtually 3 years of not keeping his promise to his wife.
So what changed? Besides the beer.
What do you think what changed?
The experience, maybe? The alcohol? The friend?
No, actually got nothing to do with the alcohol. No.
You brought that up.
It had nothing to do with the alcohol. It had to do with the context within which he did it. To do it himself is a characteristic of ADHD that is difficult. People with ADHD tend to have significant difficulty self-directing, saying, I am going to write that paper, or I am going to clean that room.
Right.
They say it to themselves. What's the consequence? They can forever say, oh, I'll do it tomorrow.
Right.
And there's no serious consequence.
Okay.
But if you change the context of the situation and make the person obligated to another person who's going to come over and who's there to complete the task, then things change completely.
Makes it easier.
That's where the real mistake is. I shouldn't call it a mistake, actually. That's where the real ineffectiveness is in what most people think they're supposed to do with ADHD.
Right.
If you have ADHD, I'll sit and talk with you and help you through it. It's utter nonsense. If you have ADHD, what I'm going to do is actually have you alter your circumstances. If you have difficulty studying, then go join a study group. If you have difficulty remembering written material, then have somebody read to you or use books on tape or the like. It's to do things differently is the way you treat ADHD.
Okay.
Now, you asked me a question a long time ago about what's the difference between ADD and ADHD. Nobody professionally uses the term ADD.
Okay.
It's all ADHD. The 3 types are inattentive type, hyperactive, impulsive type, and combined type, which is both of those things.
Okay, all the above. So what you were saying earlier, right before you answered this, is it the outside factors or environment that we're changing to help the person with ADHD?
Again, that's well said. You don't treat ADHD in the therapist's office. It's an illusion that I don't know how it got propagated, but you treat it at the point of contact.
Okay.
So, for example, our summer treatment program at Cleveland Clinic, it is the most advanced, sophisticated behavioral program for ADHD in the world.
Oh, please explain.
There's 1 in Japan. There's 5 in this country of the research type that we use. Now, by the way, I'm not self-aggrandizing. I didn't invent this program.
Sure.
This belongs to a person named William Pelham. Dr. Pelham is at Florida International University. I've known him for years, and in fact, he used to be at the University of Buffalo, and that's how we started our program here.
Yeah.
The STP came to Cleveland Clinic in 1999.
And you were saying the program itself is very effective. What is going on with the summer program? Tell me more.
You are an excellent listener.
Thank you.
You treat ADHD at the point of contact, and the most sophisticated program there is behaviorally for ADHD is the summer treatment program. We target, for example, 13 negative behaviors. We reduce their frequency during the day. And then we target 9 positive behaviors, like pro-social intervention or cooperating with another person or responding to a directive. These 9 positive behaviors we increase. And then we also train parents to do exactly the same. So what's very interesting in our world today, especially for parents, is that you probably remember Hillary Clinton's venture into It Takes a Village way back in the 90s. Our world has advanced to a place where the village, like most of us grew up in, where you'd run down the street and do something you weren't supposed to do, and the mom down the street called your mom and you got in trouble when you got home. It's not there anymore. Right. There are no norms to behavior. And the village has it's shrunk to a household. So behavior management has to occur in the household, but there's no consistency of it across households. Right. And parents are left with not knowing what to do. Right. Right. What is appropriate behavior? So a tendency is to fall back on how my own parents raised me. I turned out okay. Now, sometimes that's a question, but not to the person themselves. Right, right. So you start using the things that worked at a different time in a different context with different people. Right. And it doesn't work now. Yeah, got to customize it to our new lifestyle. Yes. Well, I'm going to say it in a little more harsh way. We're going through life looking at a history rather than facing a future. We're looking at what's already been as opposed to what we're building. Right. It's a problem that occurs in almost every facet of life. It's a problem that occurs in relationships, for example. You know, my mom used to treat me like this. My wife should treat me like that too. Yeah. Or some version of this. Yeah. So it's like high expectation based on what we went through, based on memories, versus how our lives has changed. I wouldn't even call it high expectation. I would call it an expectation from our history, whatever that happens to be. Right. And you can see ramifications of that in all different kinds of family dysfunction. Sure, sure. Now, I want to ask you about adult ADHD versus children. When an adult is diagnosed with ADHD, were they diagnosed as a child, or did they kind of like miss out on that part of their life and weren't diagnosed, and something new lifestyle changed them later on? Or how does adult ADHD usually get diagnosed? Adults with ADHD are generally referred to our lifespan clinic, the ADHD Center for Evaluation and Treatment. Because somebody mentioned it to them, you might have ADHD. Or they've had their child diagnosed with ADHD. Or they just have always known that something is off. Okay. I just had a young woman today, 21 years old, absolutely clearly meets symptom criteria for ADHD combined presentation. And she described to me the things that she does. She described, for example, that she ditches her friends. She'll make an agreement to meet her friend at 4 o'clock, but then 4 o'clock in the afternoon comes, and what she really wants to do is to go for a hike in the woods by herself. So she doesn't show up. Now, of course, she has to go clean it up with her friend, but it happens again and again, and now her friends just say, oh, that's just Julia. Not her real name, by the way. Sure. She has consistent difficulty with procrastination. The conversation that she has with herself is, I have 2 weeks to do this thing. I don't have to work on it today. I got plenty of time to get it done later. That conversation rolls right up into the day before the assignment is due. Yeah. And when she decides to do something, she described, for example, several different art projects that she really enjoys. And she'll start the thing. There will be a lot of enthusiasm at the beginning, But then when the project gets to be more of a task,
she loses interest.
She loses interest and doesn't initiate or put enough effort and energy to complete the thing. So with adults, I will tell you the primary difficulty. Adults lead lives of incompletions. Now, William James is probably considered the father of Western psychology. He wrote in 1890, "There is nothing so fatiguing as the eternal hanging on of an uncompleted task." Now, that is exactly one of the first things that I personally address with a person, an adult who comes in to see me.
Sure.
And if you look at an uncompleted task as an agreement that's been broken, you can consider that the brain never forgets a broken agreement.
Right.
If I sat down with you and I said, "What things have you gotten incomplete?" you would tell me a few things. And they're incomplete because you said you were going to do them and you didn't do them, at least perhaps not to completion.
Right.
Now, what does it feel like when you have incompletions, when you have broken agreements? It's like wearing a backpack and you're constantly putting rocks in the backpack and weighing yourself down. Everybody has had the experience of saying they're going to do something. Students in college, for example. By agreement, they're in college to complete all of the work that they have to do. So a paper is due on a particular day, on a Monday, and they haven't written it, and it's Sunday night. That feeling of incompletion, of breaking the implicit agreement that if you're in college, you're going to do the work, weighs on them. Now, and everybody has had the experience of, I said I was going to do this and I didn't do this.
Right.
The brain will never forget a broken agreement. I had a person come in mid-40s, and we were talking about incompletions, and he said, it strikes me that I promised my high school friends, 3 of them, that I was going to contact them after we graduated and went to college, and I never contacted them. He said, my brain reminds me of it all the time, and I keep saying I'm going to do it, and then I never do it. And if any individual looks to see what broken agreements there are, what things they haven't done, they've left incomplete, it's a burden. And what does it feel like when you finally do something that you've been putting off forever?
Right.
Feels great, doesn't it?
Right, of course. Okay, great. I hope you don't get a lot of calls from college kids thinking they have ADHD, because I feel like a lot of kids are, pushing the assignment to the very last day or forgetting stuff. I'm just trying to see, the line is thin between when is it actually a problem versus, just forgetfulness or pushing something back, or because we all experience that on a daily basis.
A very useful observation. It's not that a person procrastinates and that makes ADHD. You have to have the symptoms, 6 of 9 or 5 of 9 of inattention, 5 of 9 or 6 of 9 for hyperactive impulsive behavior. And you have to have the conditions. The conditions have to have been around a long time. They need to be intrusive in more than one setting.
Consistent. Okay. Now, you mentioned earlier parents could worry if their kids have it that they may have it. So is this a genetic disorder?
Professional thinking at present is that it is definitely a genetic condition.
Okay.
Way back in 2000, 2001, 2, there were maybe 4 genes that were associated with ADHD. Now I think there's over 29. I haven't done a recent talk. So the difficulty of genomically identifying ADHD is pretty significant. So
now, the symptoms of ADHD can make school, family, just like you said, relationships, everything very difficult. So how to cope? Because it sounds like something like an ADHD student that goes to a school where it's all about talking and learning and raising your hand and going into that box, and some people learn differently. What is the approach that you see fit for these students?
So there was a major study that was conducted called the Multi-Treatment Assessment Study, or the Multimodal Treatment Group for ADHD. It was started in 94, went to 96, and then several hundred children participated in this study, and they've been collecting data on it ever since. So what's fascinating is that from that study, we've gotten very clear notion that a combined approach of using pharmacotherapy and behavioral intervention is the best approach.
Okay.
Now, for very young children, the American Academy of Pediatrics recommends using behavioral intervention first.
Okay.
In our own summer treatment program and in the other summer treatment programs in the United States and Japan, investigations have indicated that you can use lower doses of medicine, and you can use when you use very intensive behavioral intervention.
Yeah.
And when you use very intensive behavioral intervention first, you can start with lower doses of medicine to have things be effective.
Okay.
Now, I think the real issue is many people consider that ADHD is overdiagnosed. I thought that's where you were going in your question before about college students coming in, and because they procrastinate, they think they got ADHD and they should have Adderall. Yeah. Well, so the truth of the matter is Adderall is not hard to get on a college campus. Sure. It is the most diverted drug that there is. Mm-hmm. You can typically buy a capsule of Adderall for $5. Yeah. During midterms and finals, costs $20. Wow. Or something to that effect.
Yeah.
So when you consider what makes ADHD, you have to do a thorough assessment. Mm-hmm. You may have seen the study that just came out that described younger children in kindergarten whose birthdays occurred just before
Is it the school year?
August 30th,
August.
yeah. Mm-hmm. 31st. Mm-hmm. Compared to kids born after that date, tend to be diagnosed more with ADHD than their peers.
The ones before school year. So
the ones before school year got diagnosed more than the ones after.
Okay.
Because if school is supposed to start on December 1st, and you're born on September, if school starts on September 1st and you're born on September 2nd, then by the time you get around to school, you're going to be a whole year older than the one who's born on August 31st.
Right.
And the kids who were born in August or before August 31st, just before the school year starts, more of them, 30% more of them, were diagnosed with ADHD. Now, automatically people are going to conclude, we're overdiagnosing ADHD. The issue is not overdiagnosing. The issue is misdiagnosing. Mm-hmm. Anybody who knows child development is going to be crystal clear about whether or not a child is actually exhibiting symptoms of ADHD or whether this is a developmental issue.
Sure.
This is a question that is consistent with exactly what you were bringing up before. Mm-hmm. College students who want an edge will go in and tell the therapist, I have this symptom and that symptom and that symptom.
Yeah.
It's up to the therapist to be able to tell, the diagnostician to be able to tell, is this ADHD? Is this someone who wants to look like they're ADHD? Is this somebody who's just anxious because they're studying a very difficult subject and they can't quite get it, and so they think they have ADHD?
Sure. And that's actually my next question was, how is it diagnosed? So when someone comes in asking for Adderall or Ritalin or whatever the treatment is, what kind of steps are taken to make sure that, it is true ADHD versus, just like you said, just trying to get, the pills?
Again, so I'm going to simplify it and turn it into a 3-step process.
Okay.
And then I'm going to comment on the 3-step process and how it's used. So the first step in diagnosing ADHD is to determine if the symptoms are there.
Mm-hmm.
So again, we're talking about 9 symptoms of inattention. How many of them are there?
Mm-hmm.
9 symptoms of hyperactive impulsive behavior. How many are there? So you have to determine if the symptoms are there. So what most people do is to use a rating scale like the Vanderbilt scale or the ADHD rating scale. And I would ask a parent and I would ask a teacher.
Mm-hmm.
So I have 2 rating scales now. And then many times people stop there. So are the symptoms there? Yes, this one says yes, and this one says yes. High level of agreement between the 2. But that's not enough.
Mm-hmm.
There's a second step, and the second step is, what can I rule out as the cause of these symptoms being there?
Mm.
Could it be the child is not getting enough sleep?
Mm-hmm.
Could it be that parents are really aberrant in how they're managing behavior in the household? Could it be that the child is depressed or anxious? What actually can I rule out as causes of these symptoms being present? That's the second step.
Okay.
Now, like I said, many times when professionals do diagnostics for ADHD,
Mm-hmm.
they stop at the first step. And even that step, I mean, there are school districts in our country who would, some of them, count and make sure they have a lot of the symptoms of ADHD because it means they get more federal aid. Some school districts, because they have such an excellent record, don't want their kids to be diagnosed ADHD, so they underplay the symptoms. So if ADHD is diagnosed, then a school has to provide accommodations for that child. And sometimes the school is so strapped for money that they do not have the capacity to provide it. Mm-hmm. So there's a subtle pressure not to diagnose ADHD. So you see, rating scales themselves there may be other things that factor them. I mean, I can't tell you the number of times that children who are in families whose parents are divorced.
Right.
And the mom thinks ADHD is complete nonsense, but the dad is very clear that it's ADHD. So the mom fills out the rating scale and underrepresents the symptoms.
Right.
The dad may overrepresent, and the parents are at odds about it. So the first step is not enough. The second step, to rule out other causes, of which that might be a cause.
Sure.
And then there's a third step. The third step is to determine comorbidity. Is there something else co-occurring, which is what comorbidity is, co-occurring with these symptoms and with ADHD?
Okay.
It's especially so in adults.
Mm-hmm.
This